Rhinoplasty has many times been referred to as one of the most complex and difficult plastic surgery procedures. From my background in head and neck and ear, nose, and throat surgery, I have a unique advantage of knowing the insides as well as the outsides of the nose. In particular, I focus on the internal aspects of the nose, where there are many different portions of and anatomical structures that are important to evaluate and make sure that they are working together in order for the patient to breathe well after surgery. The septum is one of the most important parts of the inside of the nose. If you think of it as the divider or the wall between both sides of the nose, that is almost never perfectly straight in any patient, but in many patients it is so deflected or deviated that the airway problems that it creates necessitate there being a procedure to help straighten that out. Even after previous surgery, sometimes those can be the most challenging, as if there's residual deflection of the septum and continued nasal obstruction, then that also necessitates what we would call a revision septoplasty. There are also structures inside the nose called turbinates. These are structures that look like shingles hanging from the side of the nose. The inferior turbinates are the ones that have quite a bit of function in terms of warming the air, cleaning the air, as well as essentially getting it ready for the lower airway as you breathe in. These sometimes become enlarged, in fact, sometimes so enlarged that they actually create more obstruction and they'll need to be reduced. There are many ways to do this, and I use one where I hopefully will have the patient post-operatively with minimal recovery, maximal airway, and little to no complication.